Let's talk inflammation. Many people come to me asking about their pain or their symptoms that they're having, and they give the impression that their symptoms must be coming from inflammation or that their symptoms are inflamed. And while they're just trying to convey the idea that they're having a flare-up or their symptoms are aggravated, I oftentimes feel compelled to make a clarification. There's some distinct characteristics of inflammation. There's redness. The joint or the body part is red. It's swollen. It shows a visible increase in size. There's pain involved, and there's fever. It's warm to the touch. But not all situations where there's pain equal inflammation. Inflammation has a history or a story that's consistent oftentimes with patients. It's of recent onset. It hasn't been there for weeks or months. It's constant symptoms. It's there when they're sitting, it's there when they're standing. It's there all the time, all day, every day, to maybe differing intensities, but it's there. Not a come and go type of pain. It gets worse with continued use. Oftentimes people describe symptoms that are inflammatory, that when they start they might feel a little bit of symptoms, but the more they do the worse it gets. It's not the opposite most commonly, where it starts out painful and the more they get warmed up they feel better. And finally, there's a lingering pain. There's an ache or a throb that persists after pain. So pain does not equal inflammation. So why is this important? It's important because if you give the wrong treatment to a condition that's non-inflammatory, thinking it's inflammation, you're not going to get the results you're after. Besides that, anti-inflammatories used chronically, those medications that we use, oftentimes can cause gastrointestinal problems, and that's never a good thing. So if you're having pain and you assumed it was from inflammation, but now that we've talked, you're starting to question, reach out to me at jasonwardpt.com.